If you or someone you know recently had a baby, you may be at risk for postpartum depression. We spoke with a local doctor who shared how to recognize the warning signs and find safe paths to treatment.
Postpartum depression is one of the perinatal mental health disorders that someone can get diagnosed with up to 12 months after their delivery.
The National Institutes of Health reports that about 1 in 7 mothers experience postpartum depression within the first year after giving birth.
The transition from pregnancy to postpartum is challenging for anyone. There's a lot of sleepless nights. It's challenging taking care of a newborn and addressing all of their needs. And so a change in your mood, being tired, and dealing with all of the new adjustments is very common for everyone.
Dr. Fatimah Fahimuddin says the first step is understanding some of the risks.
There are some risk factors that we know, especially if you've had a high-risk or complicated pregnancy that may predispose you to postpartum depression. If you have any complications during the postpartum period, whether that's challenges with breastfeeding or you're away from your baby because baby's in the NICU, that can also increase your risk. There are also some social changes that may predispose someone, whether that's poor social support or isolation. But ultimately, I think it's important for us all to realize that some families will not have any risk factors and they may get diagnosed with postpartum depression.
Parents should be on the lookout for specific symptoms too.
Symptoms can vary. You can have just changes in the mood where someone may report that they're feeling depressed, they're not feeling like themselves, they're more irritable, and they may say that things are just different after they give birth. Other symptoms may be a little bit more significant, where it may result in restlessness, insomnia, changes with excessive weight gain or excessive weight loss. And in some rare or severe cases, you may have thoughts of hurting yourself or your newborn or others around you.
Dr. Fahimuddin says postpartum depression is common and treatable.
There are several treatment options that are available. One thing that we know is that most oftentimes an OB provider is going to diagnose a patient with postpartum depression, so it's important for that healthcare team to talk about those management strategies and find one that's best for the patient. Some of that could include therapy, so that could be traditional talk therapy, music or art therapy, or even visualization-based therapy.
And she wants mothers to remember that they aren't alone.
Postpartum depression, even though we kind of have stereotypical symptoms, can present in very different ways. And so if you ever are concerned that your loved one or you yourself are maybe experiencing this condition, just seek out support. If it comes out that it's not postpartum depression, that's great news. But if it is, then at least we can catch it early and provide you with all of the care and support that you deserve.
And resources are readily available.
Navigating the postpartum period is really challenging. And so if you're experiencing any kind of difficulties or struggles, that's okay. And I want you to feel validated in those experiences and thoughts. What I do hope is that you feel safe enough with your OB team that you could seek out support and that we would provide that safe space and support for you.